Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. In this video, we're going to review the group of cholesterol-lowering medications called HMG coenzyme A reductase inhibitors. The first is Simvastatin, called Zocor, lovastatin, called Mevacor, followed by pravastatin, called Pravachol, fluvastatin, called Lescol, and finally atorvastatin, called Lipitor. These medications work by blocking the formation of cholesterol within the liver. We're going to cover Simvastatin or Zocor first, and then other medications in this class to make comparisons. Zocor is the most powerful cholesterol-lowering medication available. Its action is to lower triglycerides and LDL cholesterol. It also increases HDL, the good cholesterol. Zocor has so few side effects that the vast majority of patients on this medication can't even tell they're taking it. Zocor only has to be taken once a day by itself or with a meal. In addition, Zocor has been proven to decrease the risk of heart attack and stroke, thereby improving lifespan more than any other medication currently available. The clinical trial demonstrating these facts was the 4S study in patients with established heart disease. Patients were split into two groups. One group received Simvastatin or Zocor, while the other group received a placebo. All patients were followed for slightly more than 5 years. The medication lowered LDL cholesterol by 35% and notably increased HDL cholesterol by 8%. This is the first time a cholesterol-lowering medication was shown to reduce stroke. Patients on Zocor experienced a 42% reduction in cardiovascular deaths, a 37% reduction in the risk of requiring bypass surgery or balloon therapy, a 40% reduction in the risk of developing non-fatal heart events, and the risk of stroke was reduced by 29%. Most importantly, all causes of death were reduced by 30%. The effectiveness of Zocor in reducing risk of heart attack and stroke started within the first year of the study. Of the more than 800 women in this study, those who received Zocor had a 35% reduction in the risk of developing a heart attack compared to the women who received the placebo. The older patients, that is, those over age 60, received as much benefit from Zocor as did the younger patients. Furthermore, patients with low cholesterol levels benefited as much as patients with high cholesterol levels. The 4S study clearly demonstrates that men and women will have the length and quality of their lives improved by cholesterol-lowering therapy with Zocor. Yet Zocor is not the only medication in this class of drugs with proven effectiveness. Mevacor's action is virtually identical to Zocor. The difference is that it must be taken twice a day for maximum efficiency. However, Mevacor lowers LDL, the bad cholesterol, and reduces triglycerides. It also increases HDL, the good cholesterol. Like Zocor, there are several advantages to Mevacor. First, it's very well tolerated. In a large study of patients who were placed on Mevacor in a cardiology practice, only 1 person in 100 during the study period stopped taking the medication due to side effects. Mevacor was proven to be effective in the Air Force, Texas coronary atherosclerosis prevention study. In this study, just under 7,000 normal men and women with normal cholesterol levels and relatively low HDL cholesterol levels were split into two groups. Half received Mevacor 20 to 40 milligrams per day, while the other half received a placebo. All patients were placed on a good heart diet. The average total cholesterol level was 221, the average LDL cholesterol was 150, the average triglyceride level was 158, and the average HDL level was 37. As a result of the Mevacor therapy, the LDL cholesterol was lowered 25% and the good HDL cholesterol was increased 6%. Within 5 years, there was a 40% reduction in fatal and non-fatal heart attacks and a 33% reduction in risk of stroke. The need for bypass surgery or balloon therapy was reduced by 33%. An interesting feature of the therapy was the quickness with which Mevacor reduced the risk of heart attack. After just 1 year, there were 40 heart attacks in the placebo group and 23 in the group who received Mevacor. The more you lower LDL cholesterol, the more you reduce the risk of a cardiovascular event. Let's go on now and look at studies using another HMG inhibitor called Pravachol. Mevacor works in much the same way as Mevacor and Zocor. In the CARE study, Mevacor lowered the risk of heart attack by 24%. In the West of Scotland study, Mevacor lowered the risk of heart attack by 31%, and in the lipid study, Mevacor lowered the risk of heart attack by 23%. Mevacor, like Mevacor and Zocor, was very well tolerated. That is, it does not produce many side effects. The big difference between Mevacor and Zocor and Mevacor is that Zocor and Mevacor are much more effective in reducing cholesterol and in preventing heart attacks. Zocor and Lipitor are relatively new medications for cholesterol lowering. Unfortunately, these medications do not have any long-term trials which have truly demonstrated long-term safety and efficacy, although studies are currently in progress. The next question is, can there be any serious side effects from the HMG inhibitors? And the answer is yes. However, they are very uncommon. One recognized problem is on the liver, but let's first talk about normal liver function. Every day, a certain number of liver cells die and are replaced by healthy cells. This is a completely normal process. When liver cells die, they release protein contents into the blood called ALT. The normal ALT level of wear and tear on the liver is between 40 and 70 units per day. The liver can easily replace 2 to 3 times this amount without ever developing cirrhosis or permanent problems. If ALT levels were to increase beyond the acceptable range, reducing the dosage or even stopping it will result in levels quickly returning to normal with no permanent damage. When Mevacor is given at a dosage of 20 milligrams per day, over a 1-year period, 3 people in 1,000 will have an increase in the normal wear and tear on the liver. This is no different than placebo. When the dose is increased to 20 milligrams twice a day, approximately 1 person in 100 will have an increase in ALT. If the maximum dose of 80 milligrams of Mevacor is given per day, roughly 3 patients in 100 will develop an increase in ALT. The effect on the liver is virtually identical with the other medications when you look at equivalent dosages in terms of cholesterol lowering. Currently, we recommend liver ALT levels to be checked 8 to 12 weeks after starting these medications, then every 3 to 6 months thereafter. The next potential side effect occurs very infrequently with these medications. It's an increase in normal wear and tear on the muscles. Each day, muscle cells die and are replaced by new and healthy cells. Like liver cells, when muscle cells die, they release protein contents into the blood called CK. By seeing the amount of CK in a person's blood, you get an idea on how many muscle cells died the previous day. It's very common for CK values to increase substantially following exercise. Regular exercise, as most people realize, is healthy. So a certain increase in normal wear and tear on the muscles is normal, as the muscles can easily compensate by replacing damaged muscle cells. In less than 1 person in 3,000, the use of Mevacor and other HMG coenzyme A reductase inhibitors produces an increase in the normal wear and tear on muscles. Unless this increase is 5 to 10 times greater than normal, no significant damage will occur. There are, however, 2 conditions in which increased wear and tear are very important. The first is when these medications are taken with another medication called cyclosporine, a medication used in heart transplant patients. The other is when these medications are taken with the medication gemfibrozil, also known as Lopid. People who have ailing kidneys and who take high dosages of gemfibrozil are at increased risk for developing above normal muscle wear and tear. This problem can be avoided by using these medications in combination at low doses and gradually increasing the dosage until the desired effect on cholesterol, triglycerides, and HDL is obtained. The final question is, how long should someone take cholesterol-lowering medications? If you stop taking these medications, cholesterol levels will return to their previous numbers within weeks, and the benefits of the medication will be lost. Do you need to take them for the rest of your life? The answer is no. Take them until you no longer want to prevent a heart attack or until you're 95 years old. This is Dr. Eli Whitney with the Heart and Vascular Institute of Texas.